Chris Vissers from the University Medical Center of Nijmegen, the Netherlands.
Okay, thank you. After such a speaker in the US, it's the habit to have a Best Teacher Prize. EFIC does not have yet the Best Teacher Prize. As a chairman of the subcommittee, I have a very strong and good candidate. Thank you for that. I have to deal with you some of the deliverables, what's quite an opposite connection in the team. And I added on the title, not all delivered yet, because we have still a lot of things to do. I think research and education for Europe and the workshop forwards taking that issue is a pan-European benchmarking education and research programs on pain management in the European Union, and this is really important to make things possible. It's a priority of our roadmap for action. It raises awareness for improvement management and environment at national and EU level. It makes identification of best practices very important and as a huge priority. And I think we have also to discuss certification standards in pain education and research. Are we all doing the same things? These are basic standards which were taken in the workshop 4, and the rapporteurs will come on that point. But we have some basic conditions, and these basic conditions, I just mentioned them because they are really important. We need to look at the multidimensional aspects of acute and chronic pain, the multi and the interdisciplinary team approach in relation with the patient needs and problems, and that on a very proactive way. We hear that several times already. It must be translational, supported by good basic research, and it should be evidence-based approached. It must be guided by specific outcome measurements so that we can correct if our outcome was not what we expected of. And it was mentioned very strongly by the Patient Alliance that prevention is part of it, and it's an important part. We should learn from good and best practices, and the question raised already, why don't we know all best practices, all good practices, and why are they not diffused in the knowledge of all the professionals and patients all over the world and in Europe specifically? So, and finally, it was well proven also in this morning's sessions that public awareness and relevance is an important issue in a content that is feasible. It's a strong interplay between patient care, research and evaluation and education, and this interplay is very active and should be guided by the 3 teams together. And that's not easy because we are all working in a micro-environmental situation with realistic situations, and we have a macro-environmental situation. And this is around all this, because we do have a world in crisis, we do have situations which are very hard to control, and we have to look to the impact for the society, and that's what it was all about during this meeting. So just to give you an impression, and I apologize in beforehand that I can't mention all of the beautiful work done by a lot of your people and those who are not present here, because we have already beautiful examples, and EFIC and the social impact of pain work it very hard. We have beautiful examples of good practices of a lot of individual initiative in education and pain, and the rapporteurs will bring some of them. We have EFIC pain schools where you can learn how to deal and how to diagnose pain in detail. We do have e-learning models. A lot of proposals are there, but the common standard and the common practice is still a way to go. And we do have some proposal of self-management programs for patients, but also there we have still a long way to go, but they are realized and we know how to do it. There are a lot of new things realized. A patient-centered education program, like the Yalta Pain School, for example. Special skills in communication, learning with actors, pain practice-based trainings, video trainings, and everything what's possible. Hands-on courses, because professionals want to do practical things, how to do it tomorrow in my practice. Fellowships and training courses in accredited pain centers. They are there, and you can have a grant to go as a person to be trained to these centers. So EFIC and SIP is realizing a lot of all these projects already in running. And finally, the discussion of a pain specialization. There are 2 guiding pioneering countries in Europe. First of all, Israel, Turkey, and a lot of others will follow. But most important is that everything what we learn, it should be practice-based learning using new methods and techniques. And that's not always easy for a population of professionals which is somewhat older, and things like Twitter, Facebook, and these are for us very dangerous things. We have things under construction. An accredited European co-curriculum in pain medicine. It's not yet approved. We do have thoughts about, but it's not yet approved for the undergraduate, the specialist training and the postgraduate level. And that makes a lot of work because all dean of faculties in Europe of the universities do have a total independent power to adapt or not adapt to these programs. And it should be for physicians, nurses, psychologists, physiotherapists, occupational therapists and a lot of other people. And also there, our scientific society should collaborate to make this possible in education. A very good idea what was launched by Andreas Koff was the difference between a basic, a general versus a specialized program. Because we should train the primary care, the first line, the family doctors, because they are in charge in close contact and collaboration with the patients and much more than the specialized centers in the backhand. We should make specific information, educational tools and programs for patients and proxies. And it was well delineated, but how to do it at the European level and learn from each other and the best practice, again, it's a lot of work and we should go for it. And finally, how do we define these best practices? I was very happy to see an example and a try for a definition. Make them visible. Education is a long way to go. What should be realized for the future? An educational program with a collaboration with other societies, because also they are speaking about pain, World Institute of Pain, the European Society of Regional Anesthesia, the European Society for Neurology, Rheumatology and other ones. A description of multidisciplinary competences. We know what are monodisciplinary competences. We do not know what are multidisciplinary competences. A Teach the Teacher program. How should we teach our teachers and who should be a teacher? Is a good clinician a good teacher? Not always. Do we have webcasts of teaching courses? Full multidisciplinary accreditation system so that when the doctor or professional is going to a teaching course, it's not a voluntaristic activity, but it's a professional activity that we can learn from each other. And finally, a pan-European collaborative educational program, which is the intention that we can realize for the future. Research is even more difficult to look at deliverables. I think there are several good examples for a collaborative research group, like the German group for the neuropathic pain, for example, FP6, EU granting. But due to the social impact of pain working group, we realized already by the launch of the roadmap some important issues. On the European FP7 program today, pain is on the target. Pain and palliative care, symptom control and open clinical trials in pain are part of the procedure and you can ask for grants and try to get them. The European Healthy Aging System, which is on the running now, and we are very happy with that. The WHO ECD-11, a coding system to make pain visible and at a more administrative way, but no counting is not counting. And I loved that image that was hung up this morning. A contact with the Heidi tool, which are indicators asking to all people in Europe, citizens, what are you doing on different levels of problems in your life? And I think we should lobby and we should work to be in that program. And finally, specific programs for indicators, because this is really a difficult issue. How can we measure that what we are doing is good doing? Yeah, and we have to take that also into account. What is realized? A lot of things. The grants, the EFIC Grünenthal grant is a beautiful example, and there's a special group of those people who had the grant to learn, to teach, and to inform people how to do better, and we are very grateful for these possibilities. And on our conferences, there's a beautiful opportunity for networking, like you are all doing. And in our last conference, we were working very hard to make it on modern systems. You can ask, raise a question to the speaker the whole time over, and there is an interactivity between speakers, between the participants of a congress, and going for this is very attractive for people to participate. What should be realized? I think we should make a SIP EFIC research program so that we can have a research planning, because at this moment several projects are questioning the same questions and answering the same questions. So we should go for that. A European Research Institute for overview and coordination. And finally, a European Observatory on Pain who can measure what we are doing, how we are doing, what is the outcome, and what is the further planning. So outcome structure and process indicator, again, should be very important. But finally, in an important issue, we need stable funds, donations and grants. And I name it like that because we know that granting at this moment is under pressure because of crisis. What can be conclusions from this short message to you? A lot has been done, but there is still a lot to be done in the next future, and we need all of you to go further on that way. Pain and the societal impact of pain should be in the agenda of national and international institutions. Pain should be considered as a major health problem for society, impacting high costs, and we had a nice proof of that. A high need for stability in funding for research, education and patient care altogether, and implementation of pain education in academic and professional organizations so that there is a joint venture and that the umbrella of SIP and EFIC can take the lead further on for the future. Thank you for your attention.
Thank you, Chris Vissers.